Vaccine requirements for school-age kids took center stage today. The Department of Health held a public workshop, part of an effort announced earlier this fall by the state surgeon general that could eliminate immunization requirements for kids. 10 Tampa Bay News reporter Kristen Barbarisi explains what would have to happen for any changes to take effect.
This is the first public workshop the state has held to discuss potentially changing these vaccine requirements. Florida Surgeon General says it's about free choice, but some medical professionals warn there could be dire public health consequences. The workshop centered on a state rule that has, for years, required 4 additional vaccines for public school attendance beyond those mandated by Florida law. Statute already requires vaccinations for diseases like polio, measles, and tetanus. Changing those requirements would require action by the legislature. But the Department of Health could repeal rules covering other immunizations through its own rulemaking process, including vaccines for chickenpox, hepatitis B, Hib, and pneumococcal disease. Florida Surgeon General Dr. Joseph Ladapo announced plans to abolish mandated vaccination for school-aged kids back in September.
Who am I as a man standing here now to tell you what you should put in your body?
But the CDC estimates vaccines prevent about 4 million deaths worldwide each year, and some doctors warn lowering vaccination requirements could increase the risk of outbreaks, particularly for highly contagious diseases like measles.
If the level of immunization within the population goes down too much, and too much is not very much because measles is highly infectious, so something below 90%, then the virus can escape and it can start transmitting within the population.
Dr. Tang says most of these vaccines have been around for decades, are safe, and have dramatically reduced childhood diseases. And those gains could be lost if vaccination coverage drops, especially given Florida's high level of international travel.
So if you have low vaccine coverage among school-age kids in Miami, for example, where we have a huge international airport traffic, this could be very dangerous for those kids.
The Department of Health is accepting public comments online through December 22nd. It's unclear whether additional public workshops will be held. We reached out to the Department of Health for comment after today's workshop, but have not heard back. Reporting in Pinellas County, Kristen Barbarisi, 10 Tampa Bay News.